business you do.
Okay, good morning, guys, and thanks for joining. So today we are having our host. Our host is Dr. Nomsa Maphango. So I'll just give an overview of how I came to know her. So Doc actually is one of the people who helped to start kind of the same association that we're having here, one in the UK, but it includes both the doctors and the medical students and other people as well. So whilst we're trying to find a structure for our own, that's when we reached out and then we started talking and she gave some help. So because she has a bit of experience in this line of work, we asked her to be our speaker for today, and so we're honored to have her here. And I think maybe she can further introduce herself.
Okay.
Okay, Doc, I'll leave it to you.
Okay, all right. Hello, everyone. Thank you for joining on a Sunday. I guess for many of you, I don't know, what the training is like over there. Maybe it's your day off, or or you're listening in from a call room or something like that. But thank you for joining this morning. So thank you, Malcolm, as well for inviting me. It was, it's always interesting to get messages on our website. So I manage, well, I kind of manage the communications and other sides of things for this, the Adventist Doctors Support Network, which is here in the UK. It's still a very much informal organization. We're still trying to formalize, but we have had a few meetings and we had a conference which was quite, well, I would say successful last year in October. So today, the talk I'm going to share, and how long did you say I've got, Malcolm, by the way?
Mm, maybe an hour to an hour and a half, somewhere there about.
Okay, that's great. Yeah, right, fine. I'm just looking at the time. So yeah, so I won't take more than an hour, I think, because I'd love to have time to talk and find out more about you guys. But it's just going to be sharing a little bit about health ministry, some things that I have been involved in, and I won't share my history as such, but I'll kind of put snippets of some things that I've done along the way. So I hope you'll be blessed by that. And I'm sure, I don't know where you guys are in in your journey. Maybe later on we have a bit of a chat and you can share, what level you are, what you're studying. And yeah, so that's what I'll do today. Maybe as we start, I'll just have a word of prayer and then we'll go on with the talk. Our Father in heaven, I'd like to thank you so much, Lord, this morning that I can come together with our fellow believers in Zimbabwe, our young friends who are interested, Lord, in serving you as medical doctors, dentists, or other medical fields. Father in heaven, I thank you, Lord, that we can live in this time where there's so many opportunities for us to share your word using health ministry. I pray that as we spend a few moments learning more about this, that you'll bless the time that we have here. And when we leave this place, Lord, we'll be better equipped to serve you in our various lines of work and study and life in general. I pray that you bless the organizers of this group and that it can continue to grow and be a mighty force in Zimbabwe and in other parts of the world. I pray this in Jesus' name. Amen. Okay. Fine. So if you give me a second and I'll share my slides. Um, where is my... Where's it go? Sorry, let me just... here we go. All right. So unfortunately, once I share my slides, I might not be able to see you guys very well. So if there's any issues, just Malcolm or someone just shout out. Um, how are we going there? Okay, Mike. All right, so I'm hoping Uh, my mouse disables when my slides. I've got a very old computer, so my mouse is not very happy. Oopsie. Where should I move this to? Oh, gosh. Okay. Oh, well, fine. I'll just have to survive. Okay. So yeah. So I've just used the title that I was given. Um, so the title of my talk or this discussion is going to be blending clinical excellence with Christ-like service. As I said, I'm a GP working in Southampton, which is in England. And this is kind of where I live, so to speak. This is a river that flows through our city. On the right there, you've got our main stadium, St. Mary's Stadium. I don't know if any of you are football fans. That's the football stadium. Where you see the red block of flats there, my surgery, my GP surgery or clinic is just behind there. So maybe if you walk 5 minutes towards the city center, that's where I work. So I work in an inner city practice. Um, Inner city here means sometimes a level of deprivation, but also we get some of our patients from kind of some of the wealthier areas within the city, people who like bankers and a lot of retirees as well live in that area. But it's a nice place to work. But very busy. I'm not going to talk about NHS practice. So NHS is the National Health System. So in England, health is nationalized, so it's free for most people. And as a general practitioner, I'm working for a group of doctors, but a practice is given a certain geographic area to cover. So sometimes there's a number of practices in that area, but patients can choose, but they're limited more or less to practices within a certain geographic area. Um, right. So, just as far as conflicts of interest are concerned, I don't really have any. So, I'm a member of the Doctor Support Network here in the UK. I'm also a member of the Royal College of General Practitioners and also a member of the American College of Lifestyle Medicine. I haven't yet completed my qualification for that, but I am still a member. Nobody's paid me to be here, so I hope that my talk will be impartial to some extent. Well, actually, it might not be because I'm Adventist. Obviously, that's a big conflict of interest, but we're all Adventists, I hope, so we'll understand each other. Okay, so the outline of the talk really is to talk about the role of health evangelism in Adventist mission and opportunities for evangelism at our different career stages, and also some practical tools that I'll share with you as well. So as Adventists and as Christians, we know that we've got a mandate to share the gospel to all nations. And this was what Jesus gave us as a task when he was about to leave to go back to heaven. And this is what we know as our mission. I will go, which was the campaign for the last 10 years or so from the GC. By the way, I will share the slides so you don't have to be frantically taking notes or screenshots as well. And I won't read all the quotations. I'll summarize them, then you can read them in your own time. So this is the method that Jesus used when he was here on earth. Which we read in Matthew that Jesus went about all the cities teaching in their synagogues, preaching the gospel of the kingdom and healing every sickness and disease. So we know that the healing ministry was a very key part of Jesus's ministry here on earth. And he heals people from all walks of life, the rich, the poor, people who were Jewish, or not, I shouldn't say Jewish, but people from the tribe, the children of Israel, and those who were Gentiles, so to speak, at that time. And Jesus was always compassionate with people as he met them. What is our health message? It's similar to what Jesus used, and we use the same principles. So Jesus wanted people to have abundant health and abundant life. And we see that in John 2. And it was his mission to bring men to complete restoration. So not only physically, but also mentally and spiritually as well. And why is health evangelism still important even in this day? With all the modern technology and opportunities available for us. We know we know that as we're reaching out into our communities to share the gospel of Jesus Christ, there are many people who are not going to accept a religious message at the forefront. So this is a quotation from Ministry of Healing where it says, in almost every community, there are large numbers who do not listen to the preaching of God's word or attend a religious service. Often the relief of physical needs is the only avenue by which they can be approached. So that's why we're privileged as doctors, as medical practitioners, that we can use this as an entering wedge to reach out to our communities. That being said as well, this is something that I've been thinking about a lot, is when we are sharing the health message, yes, we're hoping and we're sharing the gospel as well, but we know that not everybody's going to accept it, but we still share with benevolence and we want people to be healthy, just like Jesus wanted. And not everybody accepted his message, but his aim was to make all men whole. So in the recent GC cycle, there's been an emphasis on what's called mission refocus. So for a long time, we've seen that a lot of mission work tends to happen in areas where there are already Christians there or Adventists there. And the focus in the next few years is for us to reach to unreached people groups. In one of the talks, I got this slide from a talk that Pastor Kola shared here in Europe. There's three main windows that need to hear the gospel message: the 1040 window, the post-Christian window, and the urban window. I'll just share a little bit about those. So the 1040 window is an area which is kind of in North Africa, Middle East, and goes all the way into Asia. I didn't want to put too many slides, but you can search that and get a picture of where it is. And in this area, a lot of people have never heard of the name of Jesus Christ, and is home to about 60% of the world's population. The major religions are there, so Islam, Hinduism, Buddhism. There is some sections of Christianity, a few, but also animism as well, especially in some of the central parts of Africa. That's a strong belief system there. We also have the urban window. So we know that now more than 50% of the world's population live in cities. And a lot of these huge cities have people who are very isolated, who have not heard about Christianity or Adventism. And it's our opportunity to reach out to them. There's also the post-Christian window. So countries which used to have strong Christian values and strong Christian beliefs are now rejecting those and either being secular, or even here, as I see in the UK, some people actually turning to things like paganism as well, humanism, or even adopting some of the Eastern religions and rejecting Christianity. So those are the key windows that the GC team felt are needed for mission. And one of the things that will help is the health message. So as we said before, the health messages can be an entering wedge. A lot of prejudice can be removed, as this quotation says, if people see that, oh, these people know what they're talking about, their methods bring healing, and then they'll be able to be open to find out more about what we believe as Christians and as Adventists as well. I found this interesting quotation, and I'll share later on some of the resources that I feel are useful to read in preparation for this. So this is an interesting quotation I found, and it says, God designs the great subject of health reform shall be agitated and the public mind deeply stirred to investigate. And this is the key section: for it is impossible for men and women with all their sinful, health-destroying, brain-enervating habits to discern sacred truth, through which they are to be sanctified, refined, elevated, and made fit for the society of heavenly angels in the kingdom of glory. So here it's saying that unless people have got good health, they won't be able to fully understand the truths that we have to share with them. So it's important as well that we bring people to good health so that they can have an opportunity to understand clearly. And often, even I know in our churches, you find that we sometimes have arguments or misunderstandings on some spiritual aspects, but often you'll see that because we're also not in good physical health, our minds maybe are not as sharp to be able to understand the truth. So it's important for us as well to be in good physical health and to follow some of the teachings that we're encouraged to do. Also, as we see in our world at the moment, the most common causes of death are lifestyle related. So, cardiovascular disease, cancer, and diabetes. Also, things like anxiety and depression are often really due to underlying health concerns, poor quality of life, and struggles with interpersonal relationships. And some studies have shown, well, various studies have already shown that when we make changes to those um, to our lifestyles, we can impact our risks for chronic disease. This was a study done in Europe. It's part of what's called the EPIC study, the European Prospective Investigation into Cancer and Nutrition. And it looked at about 20,000 German participants aged between 35 and 65 years. And the endpoints they looked at in the study were seeing when do these people get conditions, chronic health conditions, so type 2 diabetes, myocardial infarction, stroke, and cancer, and looking at their health habits. So they found that the risk factors they focused in on were people who didn't smoke, keeping a healthy weight. They put it as a BMI of under 30. Of course, healthy BMI is kind of under 25, but that's okay. Getting half an hour of exercise a day, eating healthier, that is eating more fruits, vegetables, and whole grains. And unfortunately, they only found that about 40%, 4% of the people had no risk none of these healthy factors. So most people have one or two healthy factors in their lives. And only about 9% had all four factors. But they found that these four factors associated with 78% of chronic disease risk. And which means that if you practice all of them, you can reduce your chronic health risk by about 80%. Right. This was also a disease burden risk factor study. This is from data group, and I think also links to the Lancet studies. So showing that the burden of disease comes from a few risk factors, and because the slide is a little bit busy, I'll show you a quicker slide after that. So air pollution is one of the biggest causes of disease. I was quite surprised to see that. High blood pressure, smoking, obesity. Then they split it into outdoor and indoor pollution. Also high cholesterol, diet low in fats, and also having unsafe water. Okay. So you can see that the major risk factors for disease are things that are all modifiable, more or less all modifiable. All right. Similarly, as well, this was from the WHO, just talking about non-communicable disease and saying that at the moment now, a non-communicable disease accounts for about 74% of all deaths worldwide. And about 86% of the people who die prematurely, that is before the age of 70, they have chronic diseases. And these are, again, diabetes, strokes, cancer, and heart disease. And again, the five major risk factors are tobacco use, inactivity, harmful use of alcohol, unhealthy diets, and air pollution. So we can see that our health message, our Adventist health message, is almost perfectly tailored to meet these conditions and to help reverse and treat them. And at the church level, when we're working as, at the church, not as necessarily doctors in the sense where you've got your own clinic or hospital, we need to focus on prevention of illness. And also encouraging people to use the natural remedies when they do have particular ailments. I'll be focusing more on kind of church-based health ministry because as medical students, I think that's where you would be, active most. Obviously, when you are medical doctors, have clinics, whatnot, there's other things that you can use. But the basis, even in hospital medicine, the basis of our treatment should be around these 8 natural remedies. Which will, as we can see there, help most of the conditions that people suffer with now. I'll leave that slide out. So this part of the study is going to just look at what you can do as students and as later on as medical doctors. I'll just go through the different stages, I think, of of your people's medical career and share some things and some tips of how you can reach out in ministry at these stages. So I started off with the student years, where I think most of you are. Um, oh, right. Mm. So there's some annotation going on the screen, but I hope it's not affecting your view of the screen. Anyway, so this part of your life and looking back in my life is, I think, the time when you need to explore a little bit more about what you want to do in your life. I know medical training is very busy, and often you think that that's the busiest time in your life, and you've never been so busy and everything. But I can assure you that when you start working, it even gets busier, and also because you've got that element of responsibility. Um, but in my I studied in Hungary, so I studied, my high school was in Zimbabwe. Then I moved to England for a while. But my medical training was actually in Hungary. It was in this the course I studied was in English. At the time, Hungary had just joined the EU, so their courses were kind of were you could use once you graduate from there, it was easy then to switch into working in the UK or other European countries. So at my local church, I was a little bit hamstrung by the fact that I didn't speak Hungarian. So I didn't do as I did a little bit of health ministry there in my later years, more in my kind of my fifth and sixth year. But I used that time to engage with my local church in whatever way I could. I was part of the choir there, um, learning, exploring different, resources around. A lot of my Sabbaths I spent not on my own, but I went to church, but in the afternoon I wasn't really able to work much. Um, so with the church, so I used to spend a lot of time reading and learning about our Adventist world as such. Also, it's a time that you can use to witness to your peers um, by living those New Start principles. Um, I will say that I'm lucky. I was brought up vegetarian. My parents adopted the vegetarian message before I was born, so I grew up as vegetarian. And this it's a simple thing, and I don't like to preach about it or tell everybody to be vegetarian, but it really opened up a lot of doors for me when I was living in halls with other students. When I was cooking, they'd be fascinated about what I'm doing, and that's a way of sharing the gospel and opening that conversation that can lead later on to talking about your faith as well. Also, when people look, when as a student as well, try as much as possible to practice things like having exercise, sleeping well, being temperate, and there I say, not drinking alcohol, coffee, tea, relying on those things. And you will notice that it will help you perform much better. And I know my mother used to teach at Seleucia University, and she gave the testimony that a lot of the placement when our students, Seleucia students, went on placement, the companies preferred Seleucia students because they didn't drink at the weekends. They were fresh on Monday mornings. They didn't skip work, and they were attentive and eager to learn. So this is something that, if we follow these health principles, God will bless us. Also use this time to network. And I'm really glad you've got the student group because as you network with people, not only necessarily in medical students, but even with other groups within the church and even societies on your campuses, you get to find out what are people's needs and also what opportunities there are for witnessing and improving your knowledge on health. If there are opportunities, then I would also encourage you to, attend short-term missions. And just going back to engaging with the local church, so get to know who your health ministry's leader is, see what projects are going on and how you can help. Um, I often say to students, your focus really here is to learn and study. So yes, it is nice to have students getting involved in the local church and do that, but it's also important to balance your time because your student years are short, but you do have the energy. So do that as well, get involved. That's the next slide. So the next stage usually is kind of your early career have I gone a slide? Yeah. So your early career. So in the UK, we call this your foundation year. So I don't know whether it's internship over there, your first 2 or 3 years after graduation. So again, these are usually really busy times for you as a young doctor. My early career was in Ireland. I was working in a rural hospital, and I was quite away from the church, so there was no church close to me. I had to travel about an hour and a half to church, so I often missed church, especially when I was on call at the weekends. So you might not have as much time to engage a lot with your local health ministries, but get to know them. You might be able to participate if you're on holiday or leave on a few events and and share what you're learning because we're learning a lot. And one of the things you realize is you might think that you don't know a lot because you're comparing it to your other colleagues or consultants or whatever, but we know so much more than a lot of our church members, and even sharing a few simple nuggets about something you've learned or something in your specialty will help a lot of people. Also, it's a time, as I said again, to take care of yourself, integrate Bible study into your life and also learning more about the health message. And as usual, you continue to witness to your peers um, in how you work. It's very important, as Christians and and life in general, to be pleasant, to be known as the nice doctor that the nurses are not afraid to go and get help from. Okay, you don't want to be the snappy doctor and then want to reach out in the health ministry to them, and also maintain the connections you've made um, in medical school and also maintaining connections with your church and other ministries in the church. And then later on in the career, so people, I guess, like myself, who are now maybe not finished your training and finished your specialty training and are now working and more established and know the system and understand the system a bit better, you have a little bit more time now, well, in quotes, I say, to kind of be a bit more involved and take leadership roles within the church in health ministries, and also starting to mentor other doctors, other trainees, students, and also designing health programs as well for the church and involved in teaching. So these are just some pictures. I was invited to help out in a mission outreach program in Gibraltar, which is part of the UK, but um, well, yeah, not part of the UK, but part of the British. How should I say this? British. It's a British overseas territory. That's it. And it was a really lovely experience to be out there. So these are some of the things that you might have a little bit more time to do because you can control your time a bit more once you're working later on in your career because you might not have as much control of your time earlier on. So I just wanted to share a little bit about a mission that I was involved in. So as I said, I was in Ireland for some years. And at my local church, we had the opportunity to get some funding from the General Conference to do a center of influence. And we decided to focus on health and a few other community projects. And I was at the time actually training in surgical training. I switched later on to GP. But why wanted to share this was I got the opportunity to reduce my hours at work. So I did kind of part-time work, and then the church actually paid me to support this Center of Influence project. And some of the things that we did were, cooking classes. We did different health outreach programs. I'll share a little bit more about those as well. But why I share this is even before I was employed, so I was just employed with them for about a year. But leading up to that, um, I've always chosen in my life to dedicate some time to church ministry of some sort, which is not on Sabbath, because often, Sabbath is given that yes, we'll do stuff on Sabbath, but it's always good to try and do stuff outside of the Sabbath as well. And I was able to negotiate to some extent with my workmates in the group that we're working. So I was mainly working at that time in pediatric surgery. So there were about maybe 5 of us on the rota. But I asked them, whenever there was the cooking classes, which we did once a month, I got time not time, well, I tried not to be on call for those days. And even for other church projects. So this is why it's important as well when you're at work to get to know it, to be good and know your colleagues well, because you can then negotiate time off or change the rota to suit what you need to do. And obviously, God opens the door as well. So it's not impossible to do health ministry while you're working as a doctor, but ask God and He can open doors. And this was a real blessing. I really enjoyed my time there, and I learned a lot from that time. So, where are we with time? Okay. So, just to talk a little bit about evangelism in general and how health ministries comes into that. Um, so, actually, before I do that, maybe let's just have a break. Are there any questions just at this stage? And then we can do the second bit because I was talking a lot. Let me see. I can't see you guys. Okay. Or if there was any questions, you're welcome to put questions in the chat, or if anybody has any questions, I'll give like a little small break for that. I know a lot of people have joined us. Um, yes, if you have, yeah, you can go. I think Moo has a question. Go ahead.
I just I wanted to ask, what did you do as a student to help maybe those, let's say, patients that you were interacting with in your rotation as you were learning the health message?
Okay, thanks for that question. All right, so I I don't want to put it as an excuse, but I was slightly limited by language. So as I said, I studied in Hungary. Um, our course was actually in English, um, but we had to obviously speak to patients and things like that in Hungarian. I managed to learn Hungarian just mainly due to church work. So I didn't do a lot of work in health ministries on the wards with patients. Obviously, when you're talking to patients, you can share, some general health principles, but just because of the structure of how our program was designed, I wasn't really able to do much in that sphere. So I focused more of my attention, I suppose, doing stuff through church and also personal interactions. I guess one interaction I can share is that I had a close friend of mine, a lady who came to our church. Her family was not Adventist, and but the daughter wanted to learn English, and we became quite good friends. And when they invited me to their house, I was like, oh no, I'm vegetarian, I don't eat meat, whatever. And the daughter was a very lovely girl that she wanted to learn more about health ministry, not health ministry, about vegetarian cooking, sorry. And whenever I went there, she'd always prepare a meal and say, when if I shared a recipe, she'd try something else. So that's one way I helped as a student. Also, as I said later on, when my Hungarian improved a little bit, I interacted with the health ministries from our local church. So we did a few health talks in the churches that were in our district. Yeah, so unfortunately, I wasn't really able to do much on a kind of one-to-one patient level in the hospitals at that time. Any other questions? April, I think I can see. I think April had a hand up, I think. I'm not sure. April Muguira. Oh, you can put it if maybe you're muted. Okay, fine. If there's no other questions, we'll go to the next stage of the talk. Let's see, where's my thing? I might go through this second section a little bit quick. I might skip a few slides because just to um, yeah, so this section is just talking a little bit about evangelism basics, and I won't go through the details, and you can explore this later. But often, as as Adventists, there's that famous quote that when Jesus was witnessing, he mingled with the people, got to know them, and then bade them follow him. So when we're doing any health ministry, either in the hospital, with our friends or churches, our aim is to really mingle and get to know people and know what needs they have, and then builds their friendship. And then later, if the opportunity comes, to get them acquainted with the Word of God. But one of the things I also like to use, and you'll see that in some of the tools I'll share about, is our programs should really be evangelistic, and our approach should be evangelistic in and of itself. So where you have the opportunity to mingle both health and ministry, health and the gospel ministry, go ahead and share that. And I think my slides are not quite in the right order. Um, but let me go to this slide first. So our typical thoughts when we do evangelism is that, especially health evangelism, is that we will think that, oh, I'm going to do a health program. It can be health expo, health cooking class. I'll do some seminar, do something else. And then at the end, later on down the line, we then invite people to do some spiritual outreach. But actually, when we do our programs, I'm thinking more at the church level, but even if when you guys are doing any outreach that you might do as an organization, or if you're offering, say, for example, you're going to offer cooking classes, or you're going to offer maybe a diabetes reversal or blood pressure reversal program, series, instead of just offering people, instead of just doing kind of waiting to say, okay, at the end of this program, then we'll offer them health. Along the way, you should also have health programs that are spiritual health or other programs that are running parallel, because some people might be interested in one thing, but not interested in another thing. So, and then as people are ready, they will drop into whatever other programs are going on. So say if you're advertising a cooking class, you say, okay, we're doing a cooking class, but on your website or somewhere else, they'll see that, oh, actually, they have Bible studies every Wednesday or something. You don't explicitly have to invite them to that, but the fact that they know that those things are going on, or there's pathfinders or whatever else, gives people the opportunity to see what the greater offer is for your church or for your group. So some of the reading as you prepare to do this, as I said, being a student is a good time to do a lot of reading. The books, of course, are traditional spirit of prophecy books, so Ministry of Healing, Medical Ministry. The book I've just put a picture there of, it's actually a printing that I did of the book. We shared it with our health professionals here. So it's a call to medical evangelism and health education. It's a small little booklet. It's very easy to read, but it pulls out a lot of quotations and just gives us encouragement of how we need to focus on mission. And I've used a lot of those quotations in the talk today. Also, you can use things like recipe books. I think I have made the mistake of using a different set of slides, but never mind. I saved 2 sets of slides. Right. So recipe book collections from your local ABC, for example, and these. Okay, it's on this slide. So you can get books from your local ABC and read those. Also, the ABC, I don't know how active ABC is now in Zimbabwe. When I was there, they used to have quite a good collection of books. Get to read the health books that are there. Also, in your study time, read your health journals. I've just put there the New England Journal of Medicine, British Medical Journal, but I'm sure that's different there. But I think these ones are also available for you guys, and I think free, if I'm not mistaken, as well. And of course, they're not talking about health evangelism, but it helps you understand what are the greatest needs in health and what are the topical matters that you could maybe talk about and address. One of the other things I forgot to mention actually on one of my slides is there is a great need for a lot of tools in health ministry and media. So if you're somebody who's got a bit of time, explore things like, web design, social media. Of course, don't let it, take over your life, because it can. I know that from experience. But these are things that will help your local churches, and also as will be a medium that you can use to share if you don't have the time necessarily to go in person. Excuse me. So some of the programs that I've used especially when I was in Ireland, but even here, and that you can use as well as health tools for programs that you might want to run in your local church. But also, they're very good if you go through them yourself, because they provide ways that you can be able to speak to your patients and share with them various health nuggets. So Celebrations is free. That's from the GC. It's a bit tricky to find the actual slides and the information. If you want it, just let me know, because I think you need to be a ministry influence, a center of influence, and then they give you a password, and it's all very clunky. The Full Plate Living is another program which talks about healthy eating in a very, very simple way that can be applied to most cultures. It is free as well. The training for it is free. It's all online. Everything is downloadable. That's one of my favorite programs that I've used, when I'm sharing health, and even with my patients. I often, because there's a patient portal that they can do and go through the program themselves, and that's all free. These tools I'm sharing are Adventist tools. So yeah, I use that a lot with my patients. I don't know how many actually take it up and follow on with it, but I do, maybe about, yeah, like patients about high blood pressure, diabetes, weight control, things like that. It's very, very useful. Creation Health is another tool that you can use. Unfortunately, it's not free, but you can use some of their online videos and handouts as well, which are free. Yeah, there's a lot of other things, depression recovery, and what I can do. I have a website which is part of our conference website where I've put some of these tools, so I can share that with you later on, and you can explore them. This is more or less similar to the other slide. Okay, so I would also encourage you as much as possible to engage with your local church, as I said, and it's good to get as much training as you can. I my in here in England, well, I'll say when I was in Ireland, the British Union Conference, they had a number of training events where they invite speakers from abroad. I'm sure you have the same there. And going through some of these tools I've mentioned, for example, had Dr. Nedley come, the Finleys, Pastor Mark Finley and his wife came to share a little bit about how they do health ministry. So as much as possible, if you're connected with your local church, or I suppose ZAMSA or other, church organizations, whenever these opportunities come up, try to make sure you've got a place on them. You can always lobby your conference to get a place. I know things are a bit different in Zimbabwe, so please let me know if I'm a bit off in that. There's also division trainings as well that happen. Look out for those things. If you have the opportunity to visit some of our lifestyle centers, clinics, and Adventist hospitals within the world or Africa, take that opportunity on your holidays or as a student, because you have, as I said, you kind of have a little bit more time and flexibility to do that. In Europe, we have this training that was started, which is called Modern Medicine and Adventism. And the target audience was for medical students and early career doctors, just to learn about, what health ministry is, and also connecting that with evangelism. I didn't attend this because when I looked at the program, I kind of knew most of it. So because I more or less self-taught taught myself, and it came a bit later on. And also it's quite a long commitment, the time factor there. But it's something, if you can share this with your divisions. It was run from the health ministries division. So I'm sorry, from the health ministry, from the GC health ministries, linking with one of our lifestyle centers. So I don't know if they have a similar thing over there, but it's something to look out for if they have it. Also, I just added this. It's not connected to my talk directly, but for those of you who are interested in surgery, Malamulo Hospital in Malawi actually does surgical training, which is linked to the Pan-African Society of Surgery. I can't remember what that stands. I can't remember what that all stands for. So you can, if you wanted to become a surgeon, you can do your training in Malamulo, and they link up with Loma Linda University, which is our Adventist university in England. So it's a good opportunity. I didn't take it up at the time for various reasons, but it's for those interested in surgery, that's something you can consider. And I don't know what the situation is at the moment, how many people they take, but if you wanted to explore that, Malawi is not too far from Zimbabwe. Um, and also, this is just an opportunity that I did. I visited one of our lifestyle centers here in Europe, in Romania, and we did a bit of training on how to run lifestyle centers. But it was also just a good opportunity to see how, how health is practiced in other parts of the world, and it's good to open up your mind. So as you do health ministry, I can share what's happened, what I've done, or what other people are doing. But in the end, you guys live in your own local individual community. And this quotation is one that I really liked that I found, and it's from evangelism, but I think originally from the manuscripts. It says, "We are to study the field carefully. We're not to think that we must follow the same methods in every place." There's the next slide. Okay, whatever may have been your former practice, it is not necessary to repeat it again and again in the same way. God would have new and untried methods followed, break in upon the people, surprise them. So when you guys are young, you've got great imaginations, take some of these programs and readjust it to fit your circumstance. I have done that with some of these programs. You don't have to, if it says celebrations, you don't have to do it exactly as the training manual says you have to do it. Even things like health expos. When I was in that in the health center in Ireland, we didn't do the full health expo because at that time I felt that it's too involving. So we just used to do simple things, maybe just check the blood pressure, do a health questionnaire, and get to know people that way. Also, depending on what resources you have. So for even us in Europe, yes, we've got more resources, but even things like, testing blood sugars, it can be quite expensive actually for a church to do that. And when you realize that, people can get that free, maybe don't spend your time doing something that people can get free anyway somewhere else, and work on another problem. So find your own way of reaching out and doing medical missionary or health ministry. And also an important thing is whatever you do, record what you do, so that you know what you did, and also it's also very good for your career. So later on, these are things you can even share on your CV to say, I did health evangelism and health promotion. They're very important things, and they also give you good tools. You learn how to speak in public, you learn how to interact with people of different levels of knowledge on health, the local church. Sometimes, if you're lucky, you might be interacting even with the local government for some of the programs. Reflect on what you've learned. So what has worked well, what hasn't worked well, what you can improve, what you can change, and report it. So write up these things, share it with your local church, share it abroad, share it on your website if you have a website, and then repeat. So one of the things I didn't maybe focus on in the slide when I was talking about evangelism is often we want to do loads of different programs, but I've always said, I always feel to myself, find something that you enjoy or that you like to do, or your church is able to do, or your group is able to do, and do that same program many times over. So don't do a diabetes program this week and the next time you're doing high blood pressure and the next time you're doing something else, because you never get that opportunity to learn from the mistakes that you've made and then adjust it. And, so focus on one thing at a time, do it well. And then when you think that's done really well, then move on to the next thing as well. So this is a quotation from William Harrison Anderson, who was a missionary to Africa and specifically to Zimbabwe as well. As we know, we've got Anderson School in Zimbabwe. So it says, "I've given my money, my strength, my wife, and I intend to give the rest of my poor self to finish the work God has given me to do. I want you who read these lines to ask yourself, what wilt thou have me to do?" And if I remember correctly, I didn't get time to double check this, but I think I recall seeing the grave of his wife actually at Solusi. I used to live in Solusi. So yeah, what is God calling you to do? And do what God impresses you to do to finish the work that we have to share the gospel. And also this is a quotation from Ellen White. It says, "God's blessing will rest upon every effort made to awaken an interest in health reform, for it is needed everywhere." All right, so that's the end of my talk. Thank you for listening. And I'll just give a little bit of time for question and answer um, if you have any questions. Okay. And you can, they should hopefully be to do with my talk, but you're welcome to ask other general questions if you have about careers or other aspects. Okay, so April, take two.
All right. Thank you so much for the powerful presentation. You mentioned something like we have to take part in our local churches. That means to do the work that lies nearest whenever we are maybe during the holidays or whatever that we are doing.
Mhm,
And that's very important. However, most local churches, or maybe it's just my local church, I think others will confirm, they have this prejudice about the health message, such
mhm.
that when you want to try and say something about it, they already have misconceptions, and there are a lot of barriers actually that will be along your way. So my question is, how can I balance that? Can you give some practical ways of trying to navigate through the barriers that have been there already, the misconceptions that people have about the meat eating question, about vegetarian, plant-based, and all those questions that people have.
Thank you. All right. So just to say, when you ask your questions, maybe just share a little bit about who you are. So I'll ask you maybe where you are in your student life and what you're studying. And yeah, April, if you can share that, that will just help me to answer the question a bit better.
Oh, all right. Currently, I'm a medical student at the
Mhm.
University of Zimbabwe. I'm part three, still doing my preclinical phase.
Okay.
Also, I am a medical missionary, trying to know more about the youth message and trying to also know more about medical missionary work. So I'm a medical student and a medical missionary.
All right. Yeah. Thank you for the question. Yes, this is a challenge. I don't want to say I've been privileged, but I have to say I have been privileged all my life to really be in churches that are, embracing the health ministry, I suppose, at a leadership level to some extent. But on the grassroots, definitely there is that prejudice. So I think the first thing I guess is, like I said, is to be a good example yourself. So I don't know what the policies are in your churches. I know in England, although it's slipping a little bit, but the policy was always to provide vegetarian meals at any events. That doesn't always happen these days, but yeah. So when you do have that opportunity to share, so even if that's not the policy, but bring in nice food that people will enjoy and taste. Um, I think when you find you practice things yourself, people will join in with you. Um, Plan programs that are, I suppose, open. So in the sense that you're not kind of saying, sorry, open in that they will allow more people to be involved in. So in my church in Ireland, in Ireland, we used to love walks. People don't mind doing that. People don't want to be told to go on long walks sometimes. But if you're saying, okay, we're going to go on a walk, then we're going to picnic, and then we will eat a meal together. So those are opportunities to do. Um, when you present the health message, so one of the programs I'll suggest is, as I said, this full plate living. It's designed by Adventists, but it was actually designed for non-Adventists. Well, I say people who are, yeah, it's designed to approach people who are in the world. And what they do is they kind of look at your eating habits and kind of say, okay, if you want to eat better, you need to have more fiber, you need to have more water. Um, they don't tell you to eliminate meat or eliminate chocolate or sweets or whatever, but they say fill up your plate with these healthier foods and it will give you these benefits. So it helps people do things in a stepwise fashion. And I think we shouldn't most even our gospel message is not a message even like Sabbath message, all these things. Often we approach it and to tell people they're wrong and we're right, but it's more we need to demonstrate what we need to demonstrate the laws of God to people to see when they look at our lives, they say, oh, actually, I want to be like this person. And even when you read in Deuteronomy, I can't remember the verse off the top of my head, but it talks about how when the people around the surrounding nations are going to look at the children of Israel, they will say, what kind of a God is this who has these beautiful laws? You know, so yes, we need to go out and evangelize and tell people and that they need to eat healthy and whatever, but do it more as a demonstration. So if you are able to do that, or you have a group of people around you who can demonstrate that, then that's the best way to start, and then people will tend to follow later on. And I want, yeah, so I can give more. I'll give you one last thing. Also, I find that when people are in crisis, that's when they tend to come to you or ask for help. So, I've always found, that's when people tend to ask me questions, even at church, to say, oh, now, I've been diagnosed with diabetes. What can I do? And then that's your opportunity now to say, well, have you considered, improving your diet, those kind of things. So, yeah, that's what I hope that gives you a bit of an answer. I know I was a bit waffly there, but okay. We have two other people. I can't remember I don't know who was first, but maybe Rutendo and Pet Rutendo. As I said as well, just let me know who you are and where you are with things.
Hi, Doc. This is Rutendo Matanda.
Hello.
Hi, Dr. Nomsa.
Hello.
It's been good listening to you.
Mm-hmm.
Well, I'm past training.
Okay.
I'm already a specialist physician,
Oh,
and I'm currently doing my sub-spec in endocrinology.
okay.
So yeah, I've been involved a lot in medical missionary work, and the students know me. So
Amen. Okay.
I just wanted to kind of sort of help you there with the answer. Thank you so much. You gave actually quite insightful answers. You might not understand the dynamics of the church in Zim.
Mm.
It can actually be quite hostile. When I started running my medical my our wellness center, I ran a wellness center with my husband. It was quite, murky waters to swim in. But I wanted to say to encourage the students and say the fact that you are actually a medical student is going to be an advantage with the conferences. They usually respect medically trained people. It's the ordinary medical missionary worker who doesn't have a degree or training in medical health or any other, whether as a nurse or as a doctor. So please don't get discouraged. I know the fight is there. We're still gonna fight. I understand the environment, but the fact that you're already a medical student is going to make you be respected. And as soon as you finish your training and you become an intern, a doctor, they don't care really whether you're an intern, as long as you are now a doctor, they are going to sort of listen to you a bit. And also, I want to emphasize the point of approaching your approach. Let it improve you first before you reach out, and also be on the lookout for the sick people in your local church. Offer help even when they've not come to you. Just offer little by little. The church knows that these people are sick. They understand their journey of sickness. So if you help them, and the positive changes that will surely happen, because God always accompanies his word. As long as you follow God's instruction, that person will get better by God's grace. When the church members see those members they knew were sick, getting healed, getting better, they were not able to walk, they are now walking even with help. The little changes, they'll be able to see them, and those will speak on your behalf. So be willing to be spent, work. Even if you're working with one person, don't go out there to fight. Don't go out there with a fighting spirit or a spirit to prove anything. Try to be humble enough and be content with helping even just one person. That one person that you help who was known to have diabetes or hypertension or even has had a stroke, and then you work with them and they get changes, they will be your most powerful testimony for the message. So be on the lookout for those, and they will help you. I've seen that we have been able to penetrate a lot of areas that we were not allowed to before, just because of results. So results will help you. They'll speak on your behalf. So don't get discouraged. Please keep doing the little that's closest to you. Once again, thanks, Dr. Nomsa Maphango, for your presentation.
Thank you very much for joining. Yeah, and I think one of the things as well to remember is we're here to witness to others. And it's not to say we shouldn't ignore our own health, our own members, but I've often found that when we folk people who are outside our church sometimes are quite appreciative of these health truths because they haven't heard them all their lives and it's new. And you find that when our church, local church members start seeing that members from the outside are getting involved in what we're doing, they will start getting more interested in getting in changing their lives. If you remember one of the pictures I shared there, it was, a lot of, so in England, our church is, we're in England, but our church is actually mainly made up of foreigners. And it's very difficult to share, the message at the moment with, the local people. But one of the pictures there, you see that a lot of the people who came to our cooking class, the majority of them were actually not Adventists. And it was tricky to get our Adventist members to come out sometimes to these cooking classes. But over time, people start seeing, oh, okay, the people outside are interested. Maybe I should take a bit more of an interest as well. So thanks for that, Dr. Matanda. Okay, Petrus.
Hi,
Hello.
thank you so much for your presentation.
Okay.
So I wanted to ask, all right, I should introduce myself. I'm Petrus. I'm not a medical student. I
Okay.
studied actuarial science with NAST,
Okay.
but I'm a medical missionary. I'm interested in, medical missionary stuff. And also, I'm an elder and in charge of the health department at my local church.
Okay.
So I wanted to ask, it's a follow-up question to what April had asked. What's a typical healthy day? Let's say you are planning a program. I understand on the GC calendar there is a healthy day. What's a typical day to plan, like to have something which is impactful? Because healthy day comes once or twice in a year. So to say in that year or on that day, you've fully impacted the local church members. What really can we do? And also for some churches, I think some churches in Harare, they are privileged to be having UZ near them. So you can easily call some doctors, but for those other churches which are far, how can you really plan an impactful and a meaningful healthy day for your local church?
Okay, that's a interesting question. So I was in Zimbabwe and I was very surprised that you guys have the whole church, the whole country does the same thing at the same time. Which we don't have. We're a bit more flexible here, so we can have more health ministry things. Um, so I think where to start is to know your church and what the needs are of your church that time. Um, so a health day, usually, of course, you've got I don't know whether you do this all from Sabbath school to the end, and it depends on on how many people you have. So, it can be tiring to do a whole day program. So I'd say focus on the particular theme. So, if it's, say, I'll use maybe high blood pressure, for example, and then say for the morning program, you'd talk about things like, the mandate for health. So, why we have health ministry, and what, and maybe looking at some of the stories of the Bible in health, Ministry of Healing. A lot of the first section of Ministry of Healing, the stories there are really, really impactful. Maybe having a sermon on that, and then the afternoon program focusing on a particular disease. That's one thing I would do. You could also do, depending on how much time you have. I don't know how churches are set up. Things like going for an afternoon walk, as well, can be something you can do. To be good to do a health weekend, if you're able to do that. So if you invite a special speaker, then do Friday evening, Saturday, and then Saturday evening. There's different approaches, I would say. I don't know whether I know the health ministries now no longer really produce. They used to produce the GC used to produce each year an actual full program. I don't know if you've seen that, Petrus, or
Yeah, I've come across that.
yeah. So you could use those as materials because they set the theme for you. And the North American division also used to do that for their health Sabbath. So they produce the whole day's program. So if you're not and it's scripted, so it's literally like PowerPoint slides that you can actually read off the slide if you're not a health person, and they're designed for the lay member to share. So I think there's a lot of things. Having a potluck, of course, a vegetarian potluck, if you can, after the program, on the Sabbath afternoon, between the divine service and the afternoon program. So yeah, I would, if you only have an opportunity to do this once a year, and ideally you should really be doing a health program once a quarter, I would say, if possible. But I know the schedules are very busy. But if you're doing it once a year, yeah, I'll try to stretch it to a weekend. If you can have, as I said, a speaker maybe on Friday, Saturday, Sunday, you could do maybe a walk on Sunday or something, or a picnic or something like that. But yeah, have it focused. So as I said before, don't give people too much information. Don't do diabetes, high blood pressure, natural remedies, or I don't know, or like herbs or whatever. Just do one thing and let that be the message that beats through that whole weekend. I would say. I hope that's helped.
All right, thank you so much.
Yeah, yeah. Any other questions or remarks or?
Can you share a bit on your experience when you went to Hegelia?
Hegelia, okay. So yeah, so Hegelia is a lifestyle center, as I said, in Romania, and it is run by. So yeah, it's a lifestyle center in Romania. It's I think the first one. I think they say they were established in the 1989, 1990, that time, just outside of when communism fell there. And so how they work, they're very, how should I say it? So when I went there, I was imagining something different, but I got there and it's slightly different from what I imagined what a lifestyle center is. So they're quite clinical actually in their approach. So when people come there, so they have a program which lasts 10 days. And so they call the people who come to the program patients. So, not clients or participants. So they call them patients. Each patient comes there and they're assessed by a medical doctor. So they have the person who runs it is a medical doctor, but he's more now involved in administration. But they've got a clinical doctor who's there. He works on his own. Each program has about 50 people, I think, who come. They're very busy. It's a very, very busy program. So the doctor will see the patient, and then they should bring their medical records from the other doctors if possible. If needed, they might do blood tests and things like that at the center, but they prefer it if people have had that done somewhere else. They will do just a general assessment and also see what the patient needs. Unfortunately, I didn't get to sit in with a doctor because it was in Romanian and they didn't really have the opportunity to have interpreters, but the doctor did talk to us separately about what they were doing. They focus obviously on a lot of metabolic diseases. So the typical, as we said, high blood pressure, diabetes, weight loss, arthritis, whatnot. And then so the doctor will give that person a program of treatment based on that. But I think all the patients will get a basic program. So they all have some kind of exercise program. They're split up into groups as to how much exercise they can do. I think there's 3 groups. So those who are, maybe walking crutches or really elderly, they'll be in a slow exercise group. And there's some people are quite fit anyway. They're coming there for other purposes. So they'll have exercise. Every morning there's exercise, like a joint exercise group, light kind of stretches, much, spots outside. But then there's also a kind of a formal exercise group later on in the morning. The diet obviously is vegetarian. It's actually, the diet is plant-based, vegan. If there are people who are really struggling with that, they can accommodate other things, but they try not to. What else? Most people will get some kind of massage therapy as well when they're there. They've got swimming, hydrotherapy available. And then they've also quite a good spiritual program. So every morning they'll have a health talk and some spiritual messages. Because it overlaps a Sabbath, so all the participants are invited to come on Sabbath. About 70% of the people who go there are not Adventist, actually, which is really interesting. so they're not forced to attend the Sabbath program, but they're encouraged to do that, and the program is tailored to be a bit simpler. So it's not, there is Sabbath school, but there's different groups and things like that, and so it's not as it's not as busy as some of our typical Adventist Sabbath programs that we have. Yeah, so why I was there was there was this, as I said, there was a group that anyone who wanted to go, the opportunity to see how the place is run. So from the back end, so to speak, looking even the financial aspects, how to plan different programs, the talks, the gardens. We got to watch some of the treatments that were given to the patients who were there. And just be part of the community there. So it was a very good experience. I really enjoyed it. There are different medical centers, the different lifestyle centers. I've also been to Vita Salus, which is in Portugal, which is it's a smaller place, and they're not as clinical, shall we say. So you still see a doctor, but yeah, it's not as clinical as Hegelia is. But yeah, I enjoyed my experience there. I don't know if you have any specific questions about it, because I've just given an overview.
Maybe probably on how it has impacted the way you're practicing right now.
Yeah. So I don't think it's necessarily changed a lot of how I practice, I suppose, because a lot of the principles I knew about them anyway, leading up to that. But I think it's more about what I want. I think it's impacted more about what I want to do in my, going forward. And I think what we as medical people should really aim to do. Of course, they were encouraging us. So part of the being there was to encourage us to also open up lifestyle centers, especially in Europe, health centers as well. So that's something that I'm working on and thinking. And when we had our conference with the other doctors, I shared my experience and shared some of the things I'd like to do in that area. It also impacted my own physical health as well. So when I was there, I made a point of eating what is there, not buying other food, and eating extra, and exercising. And it really, I wouldn't say I had health challenges, but it has really helped my own health journey, to personally kind of apply these things. Because often, especially as I said, as somebody who's grown up Adventist, I've heard this all my life. And sometimes you don't really take it seriously when you see new starts. And we tell our patients to exercise 30 minutes every day minimum. That's ideally, actually, we should exercise an hour a day. But, then I look at my life and say, actually, do I do that myself? Am I drinking water? I'm drinking maybe rooibos tea, with with sugar or honey instead. And I say, oh no, rooibos tea is healthy, but actually I should just be drinking plain water. You can drink rooibos tea every so often, but that shouldn't be my main thing. Am I resting? Am I having enough sleep? So I think it helps to refocus you. And I know that, since then I have personally been, practicing health much better myself. Yeah, and I like their approach. I think I don't want to go into the whole natural remedies, herbs, and other approaches, but I think the simple remedies that Ellen White talks about, which are in the New Start, I think if we practice those and encourage those simple things without adding too many other things, which we can add, but that's not sorry. If we just do those simple things, I think it will address most of the health problems that people have. There will be things where people will need maybe specialized herbs and all that kind of thing, but the simple remedies, and that's what they do at Hegelia. They do a bit of herbal treatments, but that's not a big focus for them. They usually, focus mainly on those 8 remedies, and people have improved their health. And I know for myself that my health is improved just by doing those simple things. So I guess when I'm talking to patients, that's what I'm sharing. I'm not telling them, take this or that. I'm telling them, those basic health things. So yeah. Okay. Any other questions or comments? April?
Sorry, I think I've commented a lot, but I just wanted to say something about the issue of us really practicing what we might want to tell others. I think on our part we really lack that. I once went to this local church, and one of the comments from the congregation was, uh, this health message lacks practicality. So they were saying, you guys, you just come to us and you tell us things, but we can't see it from you. Are you really doing it, and is it working for you? So thank you for stressing that point to say, I think it really starts with us as medical students or medical practitioners to start and incorporate all these health principles in our life so that when we go to people, the first question that they're going to ask you, because they already have, that prejudice I was asking about, they will always find justifications. And the first thing that they're going to ask you is, are you doing it yourself? Has it really worked for you? So, yeah, I really appreciate that point of us really trying to drink water, eat well, exercise, be temperate. So, yeah, thank you so much for that.
Thank you. All right. Yeah, and I mean, one thing I'll also add as well, in health ministry, I'll maybe say this is, we're kind of reaching the 1.5 hour mark, is, yeah, let's not forget God in all this. So often, when and this is something I've been learning a little bit more about in health, is that I'll just give my own, well, not testimony, but experience when, during COVID, the COVID pandemic, as you know, there was lots of health stuff going on, and the division really they produced some really nice talks. I don't know if you got them. I think Dr. Zeno, he wasn't yet the director, but he put together a few people, and I was listening to these things. Exercise, drink water, get out to various things before vaccination even was being talked about. So when I got COVID in the second wave or third, I can't remember. I got COVID later on, and I was, the first thing, one of the things I started doing was, I started, eating, making my broths with hot garlic and this and the next thing and beetroot, and I was doing a lot of things and cold showers and contrast, but all this kind of stuff. And it was later on, and I'm thankful I got a very mild form of COVID. I actually continued to work from home, which was not advisable, but anyway. But then later on, maybe 3 or 4 days into it, I was like, I'm trying to do this in my own strength. I had not really committed. I didn't see that I'd committed my life to God, because I almost felt like, if I do all these health things, I won't die. Because, studies had already started to come to say, if you do these things, there are benefits. But I didn't realize that I didn't actually commit my life to God when I got COVID, because, I could have died. It was a very bad, people were dying, young people were dying. So late that hit me really, to say the first thing with our health ministry is, let's always let's all remember that God is the one who gives the healing ultimately. It's not the remedies. It's, these things help because obviously, God has put these health laws in our bodies. But in the end, let's not forget the role, let's not forget to pray, to recommit our lives to God in any form of illness. Even now, when I get a cold or something, I ask God for help to heal me rather than, turning first to, to health remedies and stuff. And, yeah, so even when you're talking to people, let's not forget that as well. Okay. Any last comments? And then maybe I'll hand it over to Malcolm to close for us. And if you guys have any other business you need to discuss. Okay.
Question in the chat.
Okay. Sorry, I'm not monitoring the chats as well. Sorry. What about the issue on drugs pharmacological? How do you work with that in your practice? Okay. I think that would need a whole different talk to discuss. But yeah, so I'm a GP, so I'm working for the National Health Service. I think drugs have their role, and in pharmacological drugs. Yeah, I think it's a long one to unpack, but I think where we can, we should try not to use them. So yeah, in England, and I'm sure in Zimbabwe as well, say if you see a patient with diabetes, you've got a whole protocol of what to do when that patient has different stages of illness. And the first thing, so even in our textbooks, the first thing for those diseases is actually lifestyle. So they will say improve your diet. For example, diabetes, it's or high blood pressure, it's the DASH diet or the Mediterranean diet, or diabetes, of course. Okay, there's now a lot of controversy about low carb and all these things, and so there's different steps, and then you give metformin and whatever else you give. We've got an endocrinologist here, so she can share more. But I think in my own personal practice, and unfortunately, this is why I think I'm praying to God to say, to move away from, the local kind of the NHS practice and hopefully work independently. So often I see patients already on these drugs. And if I see a patient with, high blood pressure, depending on what level it is, I will, unfortunately, or not unfortunately, I will need to start them on those drugs. Say if that patient maybe had come to me as a lifestyle doctor and I've got facilities, I could say, okay, fine, let's start an intensive lifestyle treatment where I will monitor them. If they were willing to do all the lifestyle things that could drop your blood pressure quickly. But this is difficult in kind of NHS practices. We are in national, health practice, government practice. So what I tend to do, like I share some of these tools, especially with patients who are early on in the disease. So if somebody has a blood pressure, or say of I don't know 150 over 90 or something, there's a bit of time to not take medication. But if somebody came to me with a blood pressure of 200 over 100, I should start medication and then encourage them to put in those lifestyle therapies if they're open to doing that. I think that's my approach. Yeah, because we don't want people to, if somebody has diabetes very high, I don't know how you do your diabetes numbers here, but we use the minimal. So if the HbA1c was say 50 something, right? There is room for lifestyle. But if somebody comes to HbA1c of 100, then you're worried that they're going to go into ketoacidosis. So yeah, so it depends where you meet people, what approach you take, and how willing that person is as well to work with you. In my practice appointment, we have 15-minute appointments with each patient. And we've got quite a bit things. The way the NHS is at the moment is quite difficult. So even follow up, you'd need to follow up with those patients if you're going to do lifestyle a bit more closely than say if you were giving them medication. But I try where I can, but it's a bit difficult. I don't know if that's helped you answer. Let's see, what else did you say? Da, da, da. Yeah, and also I think even here in the NHS, I think across all medicine, there's a drive now to reduce the burden of medication on patients, especially as populations are aging. So, the NHS is pretty good in that there is ideas say, okay, older patients, do they really need to be on these medications? Let's take them off. And in that stead, we can then offer lifestyle or other things to them. As a medical student, how do you practically decide when to study, when to rest, when to say yes to mission without burning out or feeling guilty? Well, you have 24 hours in a day. So yeah, I think the first thing is obviously we've got our Sabbaths. I hope you guys are able to get your Sabbath off. So, make the most of Sabbath, rest on Sabbath. When I was a student, so as I said, I was involved a lot in more in music ministry. We used to have a choir practice on Fridays, then Saturday would sing, sometimes travel. But yeah, so use your Sabbath for rest, for community with people. I think when you're don't be afraid to say no to things in different stages. So even when I was in the choir, for example, I'll just give that in my final year. So in Hungary, you do kind of 5 years of the hardcore stuff. Then your 6th year is kind of an internship year, and that's where you do your final exams for for your state exams and all that kind of thing. So I actually dropped out of the choir for my final year because I just found I can't, I was too tired. I needed that Friday evening to sleep and rest, rather than be at choir practice or whatever. And they were a bit sad, and it felt a bit odd not, to be sitting in the congregation in the choir singing, that you could sing. But, it's so you have to sometimes at different stages, to adjust what you give to the church. And, let people know, that this is, and it's only for a short time, you're a student for 5 years. So I would say, don't feel guilty, first of all, even when you're a doctor, even, in the last couple of years, I actually stepped down from health ministries because I was just doing too many things in church and that had to stop. And now I've gone back to being part of the health ministries team from these next 2 years. But the church was a bit like, oh, what are we going to do? And I was like, well, you're not, God will provide, and he did. So yeah, and that's another thing as well. Try to widen as you get into leadership roles or whatever. Try to work with more people, and that way you can be a bit more flexible. But don't feel guilty. When to study, when to rest. I can't really, yeah, it's difficult. I think it's an individual thing, and talk to your colleagues. But, if you need to rest, do rest. Rest is important. You get sick if you don't rest. So try and get your kind of 7 to 8 hours of sleep, um, even if that means sacrificing church, I think. Yeah. Petrus, you had your hand up. Is it back down or?
All right, I think you have touched part of it, but I
Okay.
wanted you to stress much on the issue of overtaxing ourselves,
Mhm.
especially as medical doctors and medical students. I think we, we really need to strike a balance on that because we are overtaxing ourselves and overworking.
Mhm.
That's when then people say, as April was saying, you really practicing what you are doing? So
Mhm.
I think you've touched it when you're answering the point of studying, what time and whatnot and whatnot. So
Mhm.
thank you.
Yeah, and I think there's a quotation in one of Ellen White's books where she says, don't, it's actually to doctors to say, don't work more. When you're really burdened, it's better to actually reduce. So if you're doing, say, if you had your own clinic, say, and you say, okay, if you have that flexibility, and I know in Africa it's very hard, as a doctor, because you can see the need of people. But she says, pray the Lord send workers for the harvest. So I guess this is what we need to do, because if you do have burnout, and I've had a bit of burnout as well, of a bit here and there. Yeah, if you do burnout, then you're out. You're not able to participate. So it's better to, to lengthen. And doctors, unfortunately, even here in the UK, and I will see that in our colleagues, our consultants, and everything, doctors actually, a lot of them don't work into the kind of the 70s, 60s, 70s. Even here, a lot of doctors start retiring at 55, 55, 60, they're retiring. And that's pretty early, So, and that's because a lot of them have really kind of worked so hard that by, 55, they've got disease or illness and they can't continue. So, if you look at, it's better to try and, lengthen your career, because then you've got more to give in those later years as well in a different way. So, yeah. Okay, so I think that will be the last comment, and I'll hand it over to Malcolm.
Okay. I don't know if there are any other questions, but I think our time is actually lapsed. So thank you, Doc, for the time, for the slides, and for sharing. I'm sure we had a good time, and hopefully we'll be able to invite you to actually come in person this side. I think that would be great. So yeah, thank you for that. I think because of our time, maybe I'll just ask Arthur. Arthur, can you just pray for us to close? I'm not sure if Arthur can hear me. Okay. Okay, good.
Okay, let's pray.
Arthur can.
To our Father who is in heaven, we thank you so much for such a wonderful presentation that we've had. We have learned a lot of things, and we pray that your Holy Spirit continues to impress all of these lessons upon our hearts, and that we may actually impact the lives of your children in the world. May you continue to bless everyone that is here, and may you also continue to bless Dr. Nomsa for the work that she is doing. For this we have prayed. In Jesus' name, amen.
Amen. Thank you, guys.
Thank you. So Doc will forward the slides and some of the websites he shared, and then I'll just share in our group as well.
Okay. All right. God bless,
So
guys.
thank you.
Lovely to meet you.
Thank you. Yeah, I think we can end here and we'll also share our recording.
Oh, yes. Okay. Yeah. All right.
Okay.
That's fine. So I'll drop out and hope you enjoy the rest of your morning. Hope you are getting
Okay,
some
thank
time
you.
off this Sunday, but if not, then God bless.
Okay, thank you.
Bye-bye.